Good morning, everyone. Let me introduce myself. My name is Nurse Almira, and today I will present about a case in room 17. So we have Mrs. Clara, who is 40 years old, female, and the ethnicity is Sundanese. Patient come to hospital and report that she having trouble concentrating, feeling tense, feeling nervous, and sweating while walking. For her history, patient has tried in Jasmine Hospital with complaint chest pain, feeling tense, feeling nervous, and sweating. Sometimes she felt dizzy and shaking. Mrs. Clara complaints got worse since last night before being admitted to hospital. The patient said she has anxiety for 3 years and recur frequently. The patient also said she has hypertension. Okay, for the organ system, all looks good and normal. For head, the head looks symmetrical. The hair color is black. For eye, the patient eyes are generally normal. The pupils can respond to light and the patient eye bags appear slightly back. The conjunctiva is not anemic and the sclera is white. For nose, no swelling, no bleeding, no complaints, and the septum is right in the middle. For mouth, the lips look pale and dry, good teeth, and the patient can distinguish between tastes such as sour, sweet, salty, and bitter. The ears, the shape of the earlobe and the location is symmetrical. There is no inflammation and no wax comes out. The patient hearing function normally. For neck, no swollen lymph nodes, normal palpable pulse, no lumps, and for the chest, the shape or posture of the chest looks symmetrical. There is no tenderness and no lumps or swelling in the chest can be felt. There was a deafening sound. Breath sound in the patient left and right lungs were vesicular. For the abdomen, no wound, no bruising, no bleeding, normal bowel sounds. And for the extremities were symmetrical and there were no lesions. For social history, the patient divorced her husband 1 year ago. The closest person is her daughter. The patient has a good relationship with relatives and can be cooperative with nurse, doctors, and hospital staff. For medication history, the patient was hospitalized for 3 days in 2019 with the same case. The patient was treated and given medication for the healing process. The patient does not use alcohol and drugs to solve the problem. For sexual history, the patient does not have sexual history since her divorce. The vital sign is normal except the blood pressure because she has hypertension. No, but we use generalized anxiety disorder or GAD-7 screening tool, and the point is 10, so the result is she has moderate anxiety. So the assessment is moderate anxiety. My plan is try to comfort the patient, interact with patient in a peaceful manner, teach the patient ways to manage their anxiety. I will teach the deep breathing, muscle relaxation, positive visualization, and reassuring self-statements. The next plan is encourage the patient to consider positive self-talk like I can do this one step at a time. And then cognitive and behavior therapy and give anti-anxiety medication to the patient. Thank you, doctor. So that's all for my presentation and thank you so much for your attention.